Non-communicable diseases in adolescents are not about just diseases, it's about the future of our generation. Today, I welcome Dr. Shailaja Mane ma'am to talk about NCD in child.
Thank you.
So, talking about the NCDs, non-communicable diseases are often associated with adults.
Yes.
Yet we are seeing them increasingly in adolescents. Why is this happening?
This is true, and this is sad reality nowadays, because non-communicable diseases like hypertension, diabetes, obesity at the base, then fatty liver disease and mental health issues. There are these are the all non-communicable. List is unending, long list actually. But these are the major issues which we are facing in early age. Not only in adolescent but in children also. That is because of unhealthy lifestyle. There are nuclear families, both parents are working, and then increased consumption of fast food, which is ultra processed food, cold drinks, or we can say empty calories. So high density, high calorie, high salt food, which is for preservation of the food.
Yes.
And bad lifestyle, that means increase in the screen time. To the extent actually, and that is eating the time of ground play for the adolescents and even adults.
Yes.
And unhealthy sleeping habits. मराठी में कहावत है ना, अर्ली टू गो, लवकर निजे लवकर उठे तया ज्ञान संपत्ती आरोग्य भेटे.
Yes.
परंतु nowadays we are having everybody sleeping late and getting up early for the school or colleges, so quantity and quality of sleep is reduced. So unhealthy lifestyle is the main thing.
So adolescent obesity is rising at an alarming rate, as you told us. What do you think is driving this silent epidemic?
Yeah, this epidemic is due to thanks to various MNCs, globalization, thanks to 5G net, which is giving increase in the screen time. So blue light of the screen is hampering the secretion of melatonin, which is our sleep hormone. And it is leading to reduced quantity and quality of sleep as well, because adolescents need maximum sleep. They need minimum 7 to 8 hours sleep.
Yes.
Ideally 8 to 10, but at least 7 to 8 hours. But our adolescents are not having it. Another thing is due to various advertising strategies, and our Prime Minister says that we are having highest population of young people in our country. So 25 to 30% population is below 30 years of age. But they get catched hold of these false claims and false advertising. So इसके ऊपर वो फ्री, उसके ऊपर वो फ्री. So increase in the portion of this size of the junk food also, that is leading to overconsumption of thickly densed food.
Yes.
And sedentary lifestyle. So all the cricket and football, they are playing on the screen. And not on the ground.
Yes. So is obesity just about body weight, or is it an early warning sign for future diseases like diabetes, hypertension?
Yeah, obviously obesity is the main base for all these NCDs, because due to obesity it leads to increase in the bad fat, reduction in the good fat. It leads to increase in the insulin resistance, so it leads to increase in the sugar level, ultimately leads to type 2 diabetes.
Yes.
Third thing, it increases the lipid. It can lead to heart attacks early. So we are able to see so many news when the young adults or adolescents, they have lost their lives due to sudden heart attack.
Yes.
And it is due to all these things. Then mental health issues, because it hampers the body image also. Another thing is fatty liver disease. I am from the institute where multi-organ transplant in the West Zone is done in very nice way, and highest number of transplants are done. And globally, all over India also, and our institute also, we have seen that first cause of liver cirrhosis, no more alcoholic liver cirrhosis. It is due to deposition of the fat, accumulation of fat. So it is more hazardous than even alcohol. That doesn't mean one should take alcohol, but I want to compare.
Yes.
That it is more hazardous than any smoking and any alcohol habit.
So many parents believe their child will outgrow excess weight. Is this a myth, and what are the waiting?
Yeah, this is obviously the myth. And those babies who are premature and who are having low birth weight, but eventually they become overweight and obese, that carries more risk, because these children, 90% of them track as obese adult.
Yes.
And that all the risk continues. So children, when they are having obesity, immediately healthy lifestyle should be adopted by entire family, because children are the result of their family environment. So all the parents or elderly in the home should behave like a role model
Yes.
regarding healthy habits, may it be eating habit, sleeping habit, or habit of the exercise, or habit of the sleep. These are the four main pillars of healthy habit. So biological clock should not be disturbed,
Yes.
so that they can change their habits to healthy habits. And most of the habits, if they are cached, it may be healthy or it may be unhealthy, they continue to the adulthood. So it is the good time to give them healthy habits and gift of life, healthy life.
Yes. So we should tell the children's or the youngsters which we have in our family early only.
No, we should not only tell, we should
should-
walk the path.
Yes. Yes.
As a family, adults, entire other, their siblings also. This is a family affair actually. If parents are having healthy habits, obviously children will have. So for children, at least parents should change so that they will also live a healthy life.
Yes, sure. So obesity isn't just physical, it can also affect confidence and mental well-being.
Yes.
How closely are mental health and obesity connected in adults?
They are very, very much interlinked, because obesity leads to disturbed body image. Many times we see that children get teasing from their colleagues, even for sometimes adults also, in the community, in the school, in the colleges. And they have black pigmentation over the neck and where with other body parts also. Due to insulin resistance, they can have pimples, they can have various health issues, body odor also. So this all leads to disturbed body image. And due to disturbed biological clock also, they can have stress, anxiety, they can go into depression. And we are having excellent project which is going on in our institute. In that also we have seen they are having high score on the all psychological tests also. So obesity does not only leads to physical health issues, but it leads to mental and psychological health issues as well. And exercise leads to release of oxytocin or happy hormone, and that also helps to reduce the stress, anxiety, depression, and improve our body image as well.
Yes.
So it is having dual benefit.
Okay. So if you have to identify 3 biggest mistake families make when it comes to nutrition and physical activity, what?
Yeah, nowadays we are having various malls. So we have malnutrition at one end, where low birth weight and undernutrition is there.
Yes.
And malnutrition, obesity and their issues. So in India and many developing countries are having such unique situation. So there are various offers, इसके ऊपर वो free, उसके ऊपर वो free. So while going to the mall, parents should have healthy purchasing habits. They should have healthy habits of reading the food labels, not only expiry date, but about the how much fat, trans fat, how much sugar, how much salt that packet is having. Usually packaged food is having all the things which are hazardous to our health. So minimum or no consumption of packaged food. And because it is having high salt, high sugar in that. So purchasing habits and then eating habits.
Yes.
Eating habits should be how much we are eating, what we are eating, and when we are eating. One should not eat in front of television or any screen, mobile, because many mothers are having that habit that they give mobile because bachcha kha lega.
Yes.
But that is unilateral communication. They are not able to understand what they are eating, how is the smell. Eating is not only just udara bharana nohe jani jai yadne karma. Eating by sight, eating by smell, texture, then taste.
Yes.
Okay, and even aroma. Okay, and it is said that family that eats together stays together. So one family meal, that to dinner before 7 o'clock.
Yes.
Which is done by various ancestors, and many communities are following that also, because After food, minimum 2 to 3 hours gap should be there.
Yes.
So eating habits, then moving habit, that means exercise. There are various myths that कुछ मीठा हो जाए, कुछ सेलिब्रेट करना है तो मीठा हो जाए, उसके बदले कुछ हेल्दी हो जाए बोलना चाहिए. बर्थडे है, चलो ट्रेकिंग पर जाएंगे, like that. Cycling, walking, football, cricket, this all should be family affair, and when adults are doing, they will definitely do. Another thing is, thanks to IT industry, many parents are having, and the screen also, they sleep late, so children catch the habit of sleeping late.
Yes.
So sleep before 10 o'clock if possible. If not, at least let kids sleep. If not possible, at least below 11 o'clock. That is the best time. And make a healthy environment in the family.
Yes.
Health awareness should be there. Prevention is always better than cure.
Cure. Of course, ma'am. So now we know that the benefits of early sleeping and early
Yes.
eating. So if we fail to address adolescents' obesity today, what could India look like 10 to 20 years from?
Today's children and adolescents are future adults, and this is the demographic dividend actually of our country. And if we do not care and create the awareness and help them to have a healthy lifestyle now, they will definitely fall prey to various diseases at early age, and even DALYs, loss of daily productive work hours, and even wages also. And it can have burden of unhealthy and diseased adults in future. So this is very alarming situation, and I appeal all that this is not only government's responsibility, but it's our own responsibility. If every one of us take it as a mission to remain healthy, then obviously our entire community and nation will be healthy.
Yes, sure. Yes, sure. So finally, a last thing you want to tell to our audience, the youngsters and their parents who are listening this show.
Please follow the healthy lifestyle, and let us help our adolescents and children to follow the healthy lifestyle lifelong, to have healthy and long life. Thank you.
Last but not the least, the rapid fire round.
Okay.
I'll ask you 5 questions and you just have to give answer in one word. Junk food or
Obviously home food.
elevator or
Elevators.
stairs? Sleep or Netflix? Walking or running?
Both. If possible, running.
Yes. One word for obesity.
It is preventable, definitely preventable, and whatever stage you are at, start from now. You will definitely go ahead and follow the healthy lifestyle. Only 3 weeks takes for the healthy habit. So 3 weeks, try to push yourself, and lifelong you can enjoy your entire healthy life. Thank you.
Thank you. Thank you so much, Dr. Shailaja Mane, ma'am, so telling us about the non-communicable disease, and especially enlightening the children and their parents as well, because nowadays parents only don't listen, so what will they tell to their children?
Yeah.
So now when you go to the mall and see free 1+1 offer, it will definitely give you a free food, but it will also
Free diseases.
Yes. So
Choice is ours.
yes, choice is yours. Thank you so much.
Thanks a lot.